Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Sergeant and Mrs. Smith, you're going to love this house.
Is that a tub in the kitchen?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
What do you call firefighters who become influencers? Stop, drop, and roll models.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner. Gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we have in the studio Tacie, my wife Tacie, my partner in crime. Hello, Tacie.
Hello.
Welcome back.
Thank you.
And we also have PA Lydia, the great. Lydia the Great, they call her.
There you go.
Oh, wow.
This is a show for people who would never listen to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Pooh-head.
Follow us on Twitter at Weird Medicine or at DrScottWM and visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, or whatever. Wow, the levels were all over the place on that one. You know, when I had analog equipment back in the 70s, I never had problems with that, but with this digital stuff is still an issue for me. But anyway, all right. Well, welcome everybody. Thank you for being here. And don't forget, I'm going to try this one more time. I don't even know if we are still on Amazon's thing. They sent me this dunning letter saying, you are in violation for these things. You must supply us with this and that. And I think what it was they were surprised that with our page being as minimal as it is, stuff.drsteve.com, go check it out, that we were getting as many clicks as we were. And that's just because we have an awesome audience that is, likes to, they like us, I guess. It's weird. I don't know why anyone would like this. But
I don't get it either, but okay.
Okay, so I accept it for what it is.
Yes.
And
of course.
but they did not, I guess, understand how we were getting as many clicks as we were. Now, we're not making a lot of money. If we make $300-400 in a month, that's a lot for us on that. But still, it helps pay for the web hosting and all that stuff. Well, anyway, they sent me this Dunning letter, and so I responded to it. But they were asking me for some stuff. They wanted like SEO integration. So we don't do any. I don't know what the hell they're talking about. I just have a website. So I didn't send them that, but I said, I don't know what you're talking about. If you want something specifically, I could maybe get my web guy to look at it. And I haven't heard anything. So I don't even know if we're still. They gave me 5 days, 8 days ago. So, I don't know. We'll see. But anyway, check out stuff.drsteve.com. Don't stop using it until I say Amazon stinks, and and then we'll think of something else. Anyway, and don't forget to check out Dr. Scott's website at simplyherbals.net. We're going to talk about it in a second because he has something new. And then go to our patreon.com, patreon.com/weirdmedicine. So, Tacie,
yes,
you are back in the studio.
I am.
And so you and I did this during the COVID era.
Yes.
And you and I started doing the Patreon show because you were not able to be in studio on Wednesdays anymore because you were out of town.
Yes, that's right.
Almost every whoops. Oh, good Lord.
So someone's happy about it.
No. I hit the wrong thing.
Oops. Yeah, oopsie.
I hit the wrong thing. Well,
you can't be happy anymore.
Oh, wait, sorry. I hit the wrong thing.
Uh-oh.
Bitch be back, baby.
Yeah, so...
We're all tightened up now.
So what happened?
Oh, I got retired.
Yay.
Yeah. Praise the Lord. Thank you, Jesus.
Yep, so Tacie got laid off.
Let's have church.
But she got laid off from a job that, number one, she couldn't really talk about, and you really still can't because you're still employed for a while.
Nor will I ever, because they were decent to me except for the last little bit.
Yeah, and then you had a nice job, and then they put you on the road.
Yep, didn't like it.
And she was gone 2-3 nights a week. And then during the snow, could have gotten stuck up there for the whole weekend.
Hated that.
And so here you are. So welcome back.
Thank you. Yes.
So people will say, well, then what's the competitive advantage to the Patreon show? And the competitive advantage is we're going to start doing some celebrity interviews and stuff over there. And it's still content you can't get anywhere else.
Well, and if it's not a competitive advantage, well, I don't have to be here. So we'll
no,
figure
yes,
it
you
out.
Oh, come on.
I'm going to be too busy, to be honest.
Okay, fair enough. But yeah, glad to have you back, and I'm glad to have you back at home and all that kind of good stuff. So, all right. So, Dr. Scott, I have some of your CBD sinus rinse. That's pretty crazy. And I have yet to try it, though, because I was using my lavage all week. But I'm going to try it. You know what? I'm just going to, by God, try it now.
I just had a little hit before I came over.
You did?
Yeah.
Yeah?
I use it about 3 or 4 times a day.
P.A. Lydia, have you seen this?
I have not.
Oh, you have.
Is that the
sinus,
CBD?
Yeah, you have sinus trouble, right? Yeah, this hasn't been open. You can have it. You don't have to do it right now.
Okay.
You want it?
Sure.
There you go. You can take that one. Scott will bring me in.
What's the CBD activity in this? It's going to alter me?
It's going to alter your mental status. No, it actually helps to block the spike proteins for the COVID. We think.
You put CBD in your nose spray?
We think. There's not any scientific proof.
In vitro, that has happened.
Right.
So we'll see.
And that is true. In vitro, it is true.
Yeah.
Yeah.
Okay.
Yep.
Meaning in the test tube. That's what in vitro means.
I'm stretching it out a little bit.
But it has, it's actually pretty good. And listen, this isn't an ad for Dr. Scott. Check him out at simplyherbals.net. But it's it's pretty cool. So good. I'm glad you finally have some product.
Yes,
that you
thank
can sell.
God. After a year and a half of, you know what?
Yep. All right. P.A. Lydia. So here's the thing. You brought us one of the coolest stories that's ever been on this show. And it was the story of the person who had a tapeworm. The tapeworm had cancer and then gave the guy metastatic tapeworm cancer.
Right.
So when they biopsied his tumors, they weren't even human cells. They were tapeworm cancer cells. So that was pretty damn cool. But DNP Carissa brought a story of a guy that steeped magic mushrooms in tepid water, it seems, and then injected that water into his veins, thinking he would get high. And what he got was a fungemia. In other words, fungi growing in his bloodstream, and they were magic mushrooms. Now, he didn't actually make any. The mushroom itself is the sex organ, but he was growing the actual organism that makes the magic mushrooms in his bloodstream.
It's wonderful.
And then last week, NP Mel B did the Navage live on the air, and she has a phobia about putting stuff up her nose, which is, of course, why we wanted her to do it. And she did a great job, and she really liked it, and she's been using it ever since.
I watched that. I was
did
really
you?
impressed. Yeah, I did. I watched it at work, and I started gagging after you guys put the
I didn't even know
thing
about
up to the
that.
camera.
Oh, yeah, I held
At
the snot.
At that point,
It's awesome.
I
It
did
collects
gag,
it collects
that was great.
boogers in the bottom,
Yeah.
and it's all clean. I mean, it's all isolated from the rest of the device. It's pretty neat.
Yeah.
So good. So now we see that there is some little competition going on here between the three of you. So we're wondering what you brought today.
Yeah, I would like to preface with saying I'm not extremely competitive.
Okay, fair enough.
In things,
but
other
you did
than,
bring.
But
your
I did.
thing is going to be hard to beat.
Well, yeah, when you start strong, it's easy to disappoint, right?
That's right.
So anyway, I was lying in bed thinking, what on earth could I talk about? And I closed my eyes and I thought about seeing these tree people. So have you guys ever heard of tree men syndrome?
Yes.
Yeah, which I think
have.
is extremely weird and interesting.
Yeah, talk about it. People should Google image that right now.
Yeah, the Google image tree man syndrome. For sure, you will not be disappointed. And it all starts with some autosomal recessive mutations. So you get some mutations from both parents in EVER1 and EVER2 genes. And it essentially makes you highly susceptible to human papillomavirus.
Is that right?
Yeah.
Okay. I didn't know this about this.
Yeah.
Okay.
So anyway.
So autosomal recessive, let's talk about that for a second. So you have to have two genes, the two of the bad genes. So if you have a mother and a father, and let's just call big T, little t. And the little t is the recessive gene that we're worried about. And they both have big T, little t. You can make a 2x2 box. And hell, I'm going to need paper to do this.
Give me a 25%.
All right. let me. What this? Can I have that paper, Scott? That already has
of
the.
Course, yeah, we were.
Yeah, sorry, you're not looking at me. That's all right.
No, I'm
Okay.
talking to my friends.
So you make this box, and it's a 2x2 box, and you put a big. Let me do this here. You put the big T here on one of the on the top across. A big T on one box and a little t on the box across the top, then a big T and a little t going down the left side. So each side of a box has a number on or has a letter on it. So one of their kids, if they all just there was no randomness to this, that this would just be that they would just have these kids. One of the kids would be big T, so they could not pass along the tree man syndrome to their kids. Then you will have two kids that are big T, little t, so they will have the trait, and could pass it along to their kids, but they won't have the syndrome. And then, just as PA Lydia said, one of their kids, one of the four, will have tree man syndrome. And we're getting a call from a very important person here. Hang on a second.
Hello.
Hello.
Well,
What is she doing?
well, we're just the ratchet John to all these folks out charring the party line.
Well, has you talked to old Laverty?
No, I ain't talked to.
Lately?
She ain't been on the party line for a month of Sundays. I'll tell you that.
I heard she went to that party on the moon and she ran off with one of them highfalutin fellers.
One of them city-fied fellers.
All right. There's just so much our listeners will tolerate of that bullshit.
Agreed.
I'll holler at you when you're
No. What do you had a medical question? What is it?
Yeah.
Okay.
I was just going to ask you about this rash to get on my chest.
Okay. Tell us about it.
Okay. It's on the lower left side of my chest,
And I get it sometimes when I have a heat rash, like mowing the yard or something. Then it goes away. I can put some cortisone on it or something. But I got COVID back at the end of December, and I've gotten over it. But the rash has come back, but it won't go away.
Interesting.
And it's just like red spots. It almost kind of looks like chicken pox. And my doctor looked at it, and he thought it would go away, and he gave me some steroid cream, but that doesn't really seem to help it much. And I've been doing that for about a week.
Wait, it looks like chicken pox, so it looks like little papules, we would call them.
Yes, and it doesn't itch or burn or anything.
Doesn't itch or burn, okay. Less likely to be herpes then.
Okay.
Because you can get herpes anywhere. Yeah, what are we going to say, Pia?
It sounds like a little virus thing, right? It sounds a bit viral.
Yeah, well, that's interesting, but he says he's had it for years, though, too, so...
HPV.
Yeah.
Yeah, oh, yeah, okay, fair enough. Could
be. Great timing.
Especially with his history.
On his chest, though?
Oh, yeah.
Well, I don't think I've got herpes.
Oh, knowing your history, that's
I've
a good risk.
I've had it looked at before.
Yeah.
And they think it's like, like a dermatitis type thing.
Yeah. Well, these are really hard to do over the phone, and they're even hard to do when someone sends you a picture of it. You got to see them live. But COVID can trigger an itchy, widespread rash, but it's usually, we would call it urticaria, you would call it hives, and it's splotchy red areas that are intensely itchy. And so this is not that. Now, when I hear someone say, when I get sweaty, I get a rash in this one circumscribed area of my skin, I think fungus.
Mm-hmm. You think what?
Fungus. And
okay.
I would use an antifungal on that just for fun and see if it goes away. Now, you got to use it for 2 weeks straight. You can't just wait till the thing goes away and then stop using it. You got to use it beyond that. And, yeah, go ahead.
And I didn't mean to interrupt you, but what I would do before when it would happen, and it would seem like it would happen when I'm mowing the yard or something.
Yeah.
And then I would put some cortisone on it for a day or two, and it'd go away.
There are some tinea infections that sort of fade into the woodwork until you get sweaty or you get a lot of blood flow to the skin, and then they'll kind of become visible again. It's almost like invisible ink. And that's one thing. Lydia, you got any other ideas on that?
No, I wondered if when he gets like a sunburn, if those areas are more.
Yeah, how about if you get a sunburn, is it lighter than the rest of your skin?
No, it's not.
Well, the hell with you then.
So this fungal thing,
it's like playing checkers with this.
Can you get it over the counter, or do I need to check back with my?
No, you certainly can. There's all kinds of antifungal creams that are sold over the counter, and for people who have there's fungal infections of the scalp that you can get a Nizoral shampoo. It's ketoconazole. And it works really well for people who have really bad dandruff that's caused by fungi in the skin of the scalp. So so you can buy all kinds of stuff over the counter.
But it's just, is there any significance? It comes up in that same spot.
Yeah, because that's where it's living. That's my hypothesis. So Lamisil is one.
I had chicken pox when I was about 35.
Yeah.
But that
Now, when you had chicken pox when you were 35, did you have a really bad syndrome with that? Because usually when adults get chicken pox, it sucks.
I would say moderate because I got on it early.
Got on? Oh, so they gave you the...
I broke out, I would say a moderate breakout, but not super severe.
Okay.
Does that make sense?
Yeah, and then they gave you the antivirals for it?
Yes.
Okay. All right. Well, I don't think that has anything to do with this, but I would like to see it. Now, if it turns into blisters and ulcerates and then heals and then goes away and then comes back, it may be a herpes virus. Shingles and chickenpox are herpes viruses.
Okay.
But
then it seems like, and I'll tell you this and I'll let you go. I know you're busy. It seems like when I get up in the morning, it looks a lot better.
Yeah.
But as the day goes on, it looks worse.
Yeah. Yeah, that all kind of fits my hypothesis, I think. So get some Lamisil. Talk to your primary care. But this is stuff I can recommend things that you get over the counter. Get some Lamisil, put it on for 2 weeks. And then if it doesn't go away, see your primary. And if he needs to send you to a dermatologist, the dermatologist absolutely can figure it out.
Okay, because when I went to see my primary care the last week, of course, I go early in the morning.
Yeah.
And it almost looked like it had cleared up.
Yeah.
But, by about this time of the day, it gets red again. I mean, it's not super bad, but it's more annoying than anything.
Gotcha. Yeah. Yep.
Okay.
All right.
All right. Thanks.
That's all I know. I'll tell you that. Go see Doc Carson. He'll put some liniment on it.
I like your show.
All right. I'll see you later. All right. Bye. Jesus. Maniac.
Every day for 15 years. I hear that.
That's true.
Hey,
all right.
Hey, can I say
well,
something?
I was doing this thing, so let me just
go ahead.
So PA Lydia, exactly right.
Give yourself a bill.
Is that they would have one kid out of 4, or 25% on average, would have this tree man syndrome. And the only reason that I go through that is just to derive it for the listener so that they understand we're just throwing out a number at random, that there's a reason for it. But anyway.
Yeah.
Cool.
So super rare. I think only 200 cases have ever been identified since 1922.
Wow.
But it's part of so that mutation that you just described would give someone EV, or epidermodysplasia verruciformis, which is a less it's a syndrome that can manifest the HPV lesions more as like warts or diffuse warts or skin lesions. But
how do you treat it?
So specifically, you would have to remove the lesions. They're chronic.
So they just scrape them off?
Or
so those are just really warts
grafts.
when someone has that tree thing? I mean, basically.
Yeah, they're warts. So, when they develop the tree man syndrome, they get these bark-like projections that grow and are completely debilitating. Some grow from the face, but a lot of times you see them on the hands.
Yeah.
And so, they have to go in and surgically remove them and do skin grafts, and they continuously grow back because once you get exposed to HPV, typically, at least with this genetic mutation, you do not clear it.
Yeah. God, I wish I had an I Am Groot drop on my soundboard right now.
Because it looks like Groot.
Yeah, it does.
Yeah.
It's amazing.
Anyway.
Well, yeah, boy, I learned something today. Okay. All right, you're still in contention there. That was a good one. Did you bring anything else with us today?
Well, it was just
we have a million calls, but if you have something.
Let's do calls. That's good.
Okay.
Yeah.
You sure?
Yeah, I'm kind of a nerd. I was going to segue into virals and using viruses to, injecting viruses into tumors nowadays.
Yeah, no. We've talked about that on the show.
Yeah.
Matter of fact, you can go to drsteve.com and click on non-pseudoscience cancer cures, and I talk about that. So let's talk about it. Let's talk about multiple myeloma. Are you familiar with that one? Yeah, okay.
Not
well, I know you are the cancer. But
not with a viral treatment.
Okay, so what they did was they took measles vaccine. So apparently the measles virus is very, what we say, trophic, and it loves to live in myeloma cells. So they gave this person 6 million doses of measles vaccine, and the measles vaccine was genetically altered not to change the activity of the virus that they were injecting, but merely to have the virus have a receptor for, I think, radioactive iodine. And so what they did was they injected this person. They got pretty sick. They felt like crap. And when they gave them a dose of radioactive iodine, it lit up all of their myeloma tumors. And then within about a month, they were completely free. So it's called viral oncolytic therapy.
Yeah. And
anyone that has multiple myeloma, if you want to get into a trial like that, you can just go to clinicaltrials.gov and see and put in multiple myeloma and viral oncolytic therapy, and see if there's a trial close enough to you to justify going to it.
Right. That's
so. What did you have?
Well, of course, the polio trial was one of the first ones, right, where they inject polio virus into glioblastoma.
Oh, now I haven't heard of this one.
Yeah, so
we're
that
going to educate each other today.
Yeah, that was one of the first viral oncolytic trial. So
Okay.
in people who had the polio vaccine in childhood,
Yes.
right, so should have some immunity to polio, they would inject the capsid or something very similar to an active polio, but of course
Probably
it was
live
not
attenuated.
active. Yeah,
Right.
directly into the tumor to elicit an immune response.
Okay.
Right, to get those cytotoxic T lymphocytes that
Which normally don't fart around in the brain too much.
right, but you can get them there. So
Shit. Hang on. Okay, we're good.
yeah, you can
Sorry,
get them there.
I
So,
just got a message on the computer. I thought we stopped recording. Go ahead.
the immunotherapies we use that utilize cytotoxic T lymphocytes, like there's Opdivo and Yervoy, they're really notable because they have great activity in the brain.
Wow.
So, yeah,
And
they'll
that's
certainly go there.
So, we've been talking for years, from almost the first show, that cancer. You're an oncologic PA. That cancer, the days of chemotherapy, we're going to look back at this as how effing barbaric could we have been, because the answer to cancer is immunologic.
Mm-hmm.
It's a failure of the immune system. Would you agree?
In combination with an upregulation of transcription, so an upregulation of cell division of cells that have become immortal.
Right. But if the body was doing its job properly,
yes,
it would have noticed that and kill it before it was allowed to. You haven't probably heard me give this analogy, but my analogy for cancer is like you got a serial killer living in your cul-de-sac, and he's got people in the basement, but every day you go by and this fucking guy's out there mowing his lawn. Hey, how's it going? And going to work and all this stuff. And when one of the people escapes and says there's 4 other people in the basement, that's when the villagers show up with their torches and
right.
Put the guy
when he's uncovered. So
that's right.
One of the main ways we've started to use the immune system to finally allow it to recognize cancer cells and kill them is by exploiting these receptors on cancer cell surfaces. So they upregulate expression of these receptors called programmed death receptors, programmed death 1 and programmed death 2. And so when that cytotoxic T lymphocyte that should be patrolling the body looking for cancer cells, when they come into contact with that programmed death receptor, it has a programmed death ligand. So they match up, and that causes inactivation of the T lymphocyte.
Yeah.
And so the immunotherapy drugs that we are using largely just either bind to the ligand side on the T lymphocyte or the death receptor side on the cancer cell, and then those white cells they don't get deactivated. So that's been the probably most major breakthrough, I would think, in the past 10 years.
Yeah.
And we can use them for virtually any malignancy. There's good data with very, very, very low chance of side effects.
So have you seen the trials? And I know I know you must have, because one of these is on the market now. But the original trial that I saw, or it really was a case report because it was just one patient, they took out this patient's white blood cells. They exposed it to her stage 4 cervical cancer proteins outside of her body, and then injected them back in, and they all went, oh, I know what to do now. And they went, and that woman is walking around today cancer-free.
Yeah, so, and we have trials going on in largely every solid tumor doing that. And it's almost like getting a bone marrow transplant when you do that, because the person has to go in and have all of their lymphocytes depleted. So they do receive some chemo.
Oh, interesting.
Usually. Yeah. Now, there are some trials.
So you have to go kill the white blood cells and then
re-inject the targeted ones.
The good ones.
Yeah. But they're getting swifter about it. And I recently attended a talk where they're working on a product where you can largely skip that step. I had one patient who went for colon cancer. For a similar therapy, and because he essentially was like a bone marrow transplant status, he was responding. He had these new lymphocytes that were specifically targeted to kill his cancer.
Yeah.
They didn't have his good cells yet, and he died from a common cold.
Oh my goodness.
So
AKA
it's not perfect
COVID-19,
yet.
right?
Yeah. No, it was actually it was another coronavirus, but not
course.
COVID-19. Yeah. So it caused a hepatitis, and he died rapidly.
Wow.
But they're getting better at that. So yes.
Yeah.
It's fascinating.
Good. It is fascinating.
Yeah.
So that will be the key. I used to, when we first started the show, I was saying we're 100 years away from a generalizable treatment for solid tumors, and now it's not even 25 anymore. We're really, really close.
Yeah, it's exciting.
Yeah, it is exciting.
So I'll never leave oncology.
Yeah. It isn't the final frontier, though. The final frontier is going to be neurology. Because we still, after all of this, we don't know what consciousness is. How does the brain work? How does anything do anything? And so we really have a hard time treating mental illness and stuff like that because we just throw buckets of serotonin into people's brains because somebody did a study that showed that in people who are depressed, their serotonin levels are low. That's a really sort of just broad strokes approach to this stuff. And if we ever want to upload our consciousness into machines and truly live forever, we better learn a whole lot more about how our brains work, because it is amazing when you think about it. Somebody reminded me of something the other day that happened to me when I was a little kid. I haven't thought about it in 60 years. And it's still in there somehow. There's some semblance of it that's recreating it. It feels like it's a real memory. But and then you look at these concert musicians, and they play all this stuff, from memory.
Yeah.
And it's how many bits of data does that take to get the velocity and the tempo and the speed and the notes and get all the fingers going in the right place and all that stuff? Yeah, go ahead.
Can I just add one quick thing that one of my friends, Jens Kruger, the Kruger brothers, he's a banjo player, aficionado, and he writes symphonies and mixes them up with bluegrass music, and it's just incredible. Yeah. But he wrote one for the Appalachian Mountains and Roan Mountain, and one for for the Rocky Mountains.
Yep.
But he was telling me that in just one of his pieces, he had written 250,000 notes.
What?
Wow.
250,000 notes for the banjo.
Well, Mozart, there's too many notes.
No, and he, of course, I mean,
remember what his line was?
Yep.
Remember what Mozart's line was to that?
No.
When the emperor said Mozart, he was the first viewing of the magic flute.
Oh, okay.
And they were trying to, at that point they were trying to, degrade Mozart's standing. But the emperor said, Mozart, there's too many notes, which it's one of the greatest operas ever written.
Yeah.
And this could be apocryphal too. I'm sure it probably is. And Mozart just said, "Okay, tell me which ones to take out." Now, I've done that with patients when their families say, "Well, my mom's on too much medicine." It's like, okay, which ones should we take off?
Yep.
Sometimes you can find a few, but most of the time they're on these things for a reason. So, but anyway, 250,000 notes.
Yeah, it's crazy. Yeah, yep. And he's written a number of them, and he'll sit there and he'll play a. When they play live, he just goes right through it.
Yeah. Right.
I don't know.
Yeah, and then we have this thing called muscle memory. I mean, I can still play some piano pieces from way back in the day, but it all feels like it's muscle memory. I don't think about it. I just do it.
Mm-hmm.
Isn't that interesting?
Well, and the funny thing is, too, in music, especially with the way those guys play, and these professionals, I think they can almost kind of hear the next note, and they just kind of know where it goes in sync sometimes.
Well, yeah,
to a certain degree. I don't know how it works.
So anyway, that's neurology. Yeah. Okay, so we will conquer. Yeah. We'll conquer oncology, but neurology's got to be the next thing, because healing a spinal cord that doesn't work anymore, because it's been traumatized or whatever, and any of those kinds of things.
Dementia, Alzheimer's, Parkinson's.
Yeah. All of the above.
Yeah.
Depression, psychosis. We don't have a clue. And then if we're going to build thinking machines and we don't really understand how consciousness works, then what happens when we put a machine in charge of our nuclear arsenal and then it becomes psychotic because we never really because we didn't understand.
Well, maybe Elon Musk has made some headway, right? With
I hope so.
Neuralink and
yeah, that's pretty interesting. I'll sign up for that.
I would too.
Oh, I'll absolutely
What
sign
is
up. So it's Neuralink. It's where he's interfacing computers with people's brains directly.
Okay.
And they've done some of this stuff. There was something that came out not too long ago where they did some sort of it was like a functional MRI, but I can't remember, where the person would recite numbers in their head, and then they could take the output of this scan that they did and they could hear the numbers. It was very indistinct, but if you tweaked with the audio, you could absolutely hear him going 1,
That's crazy.
2, 3, 4. Yeah, it was crazy.
That's insane.
So that's just the beginning. It's once you get that, now you can build on that and do some really cool shit. So I'm looking forward to that. Right now, I'll stick with my Oculus. Anyway, all right. Where are we going from here? Well, I guess
questions.
I advertised this show that we're going to answer a bunch of questions, but that was fascinating. So thank you.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
Number one thing, don't take advice from some asshole on the radio.
All right, let's do this little feller. Right, Char. Oops, oh, sorry.
Scott, maybe? How you guys doing?
Hey, good. How are you?
Here's one for you. About 3-4 times a year, I get a pretty bad eye twitch in my left eyelid, upper eyelid. And it gets so bad sometimes that it affects my vision, where it's like pushing down on my cornea.
Good
and it's
Lord.
lasted sometimes up to a month. So, 3 quick questions.
Yeah.
Is this bad enough to go see a doctor?
Yes. It's affecting your lifestyle, so absolutely. Question number 2.
Number 2 is what kind of doctor do I see? I don't want to mess around with my GP if I don't.
Well, okay. It would be an ophthalmologist. An ophthalmologist treats this condition. I'll tell you what it is in a second.
Have to, and just get referred anyway.
Yeah.
And number 3, what kind of treatments can I expect that any doctor would have?
Okay, good. All excellent questions. So, Lydia, do you know anything? Do you have an idea what this guy has? I'm pretty sure I know what it is.
I mean, he said he gets an intermittent growth on.
He gets a twitch in his eye, and it hurts. So he gets spasm in the eye.
No.
So it's called blepharospasm. And blepharospasm, that's okay. I wouldn't expect an oncologist to know that. It's, a blepharospasm is spasm of the eyelid, and it can be sometimes so severe that it can be lifestyle threatening. And it sounds like this guy's is. So he has to see an ophthalmologist, and one of the treatments would be you want to go see him when it's happening, because if you go when it's not happening, it's like going to the auto shop and saying, well, it was making this weird noise a week ago. How are they ever going to find it? Mm-hmm. So you want to go when it's happening. He says it happens once a month, or it happens for a month at a time. I can't remember exactly how often he said it happens, but it happens when it's happening. He can reproduce it, and they may give him Botox.
I was thinking Botox to the nerve that's affected.
Yep, absolutely, and that'll work for about 4 months. And if you do it 3 or 4 times, you may not need it anymore, because the weird thing about Botox is, and this is true of Botox to your forehead too, the more you do it, as long as you stay within that 4 months, the less you will need it over time. And I've done it. I've used botulinum toxin for people with a thing called post-thoracotomy pain syndrome. PA Lydia knows what that is. But when they open up your chest to do a like a lobectomy, to take out part of a lung, they put a spreader in there, one on the top rib and one on the bottom rib, and then they put a lot of pressure to open it up. And when they do that, they often crush the nerve that runs along the top of that rib, of the bottom rib. And people will have pain for years for that. And one thing you can do is you can inject that area around the nerve with Botox, and it depletes a thing called substance P, and it'll do it for a long time, for up to about 4 months. And I know the times that I've done it on people, we'll do 2 units every centimeter along that scar, and then after 4 months it comes back, we do it again, and then 4 months later it comes back, not quite as severe, we do it again. After about the 3rd injection, we don't have to do it anymore.
That's great to know, because people are on long-term opioids for that.
Yeah. No, true. Yeah. Well, the problem is it's so dang expensive. So I've gotten the workaround for that is not to charge them for the Botox. I only charge for the injection, and then I get them to go to a place and you just pay cash and get it at cost. Nice. And it's about $300-$400. But if you have that kind of horrible pain, you've been taking high dose opioids, and you can get off of that, it's worth it. And some people can't afford it, and that's it's unfortunate. That's our healthcare system right now. But the other thing is, if the injections don't work, they can do surgery. Okay, so blepharospasm. Check it out, my friend. All right. Oh, this is one for PA Lydia. You have your.
Hi, my name is Christy. I live in New Jersey.
Hey, Christy.
I have a question about nerve pain. I have an uncle who had cancer treatment for bone cancer, and the radiation damaged the tissues around the spine. And ever since December, I guess early January, he's had very bad leg pain and foot pain. And I'm curious if you know anything that can help, and if you know anything about lidocaine infusion.
Yeah, okay. So I'll answer the last part. Lidocaine is an anesthetic. We also use it for cardiac arrhythmias, people with weird heart rhythms. But it's primarily known to the public as an anesthetic. When you go and they're going to do a biopsy on your skin, they'll shoot you up with lidocaine. You can infuse it into veins and arteries and stuff, and it'll bathe that area with lidocaine, and it does work. The problem with it is it's not long lasting. Usually lasts, it's very short term. So it's not really a solution to this. So Lydia, you see this stuff all the time. What do you think? And then we'll go around the circle, because Scott knows a thing or two about this too. And then Tacie, we'll get you to give your opinion on treatment for neurogenic
This is a little bit more difficult, right? Because the cancer treatments can cause neuropathy, right? As in causing direct damage to the nerves, usually starting distally, like at the fingertips or the tips of the toes, and then they would work upwards. So for that, things like supplemental B12, alpha lipoic acid.
Yeah, we use alpha lipoic acid all the time. Glutamine.
And then other medicines that would kind of specifically dull nerve pain, like gabapentin, right, or Lyrica Cymbalta. But this case seems to be more derivative from the actual spine, and I don't know if there's still tumor there, or if he's kind of still proximal from radiation where there's still some inflammation. So sometimes using dexamethasone, a corticosteroid, to calm down any remaining inflammation there at the spine will help.
Yep. That's to reduce the mechanical pressure on the nerve.
Yeah. And then certainly I know she was asking about doing direct therapy, like a direct injection or numbing therapy. I don't typically refer people for that, especially if we're treating malignancy.
Yeah, the anesthesiologists don't like to stick needles into tumors either.
Right.
So Scott, what do you got?
I was thinking the same way she was. Just kind of depends on where exactly that pain is. If it's down in the feet or legs, if it's pretty diffuse, we use acupuncture. We use electrical stimulation. I like to use it away from where the tumor is. Yeah. Depending on where if the radiation is in a local area and there is a lot of inflammation, I like to put needles around and stem that and try to do like a nerve block, and sometimes can get some pretty good relief. And and depending on how low it is in the spine. Sometimes they'll go in, I'll refer them to my buddies, and they'll do epidurals above that level sometimes, but if it's down there, the tumor, no way. They're not going to go anywhere near it. Yeah. Yeah, so I mean, there are a bunch of treatments that we can certainly do for post-radiation, post-chemotherapy neuropathies, pain syndromes.
I'm not sure what kind of bone cancer. We typically would think about bone cancer being described as multiple myeloma and not like a primary bone sarcoma or something like this. But it's fairly common to have someone require a very low dose of dexamethasone, 1 to 2 milligrams, which shouldn't
which
really
is a corticosteroid,
a
steroidal anti-inflammatory.
And sometimes you can do some topical stuff too. Just to pull some of the inflammation right around where if it is a radiation burn on the skin.
If they're feeling pain close to the surface, I agree with that.
Yeah.
We use so if there's tumor causing the problem, radiation therapy should be the key to this.
Oh yeah.
Just to shrink the tumor around there, but we will for neuropathic pain that is not amenable to any other treatment. We'll use methadone for that. Believe it or not. People think, well, methadone's to get you off drugs. No, the only reason the federal government uses methadone to get people off the drugs because it's cheap. It's dirt cheap, and it lasts all day. You give one dose, it lasts 24 hours, or can if you give them enough. So, but one of the interesting salutary effects of methadone is that it is really good at blocking a receptor called the N-methyl-D-aspartate receptor, which is NMDA, which doesn't matter what it is. There won't be a quiz at the end of this, but it is involved in neuropathic pain. And when you block that, you can improve neuropathic pain significantly. So we'll use that. And the antidepressant duloxetine is really the drug of choice for chemo-related neuropathy. But a lot of times people are already on Zoloft and other things like that, and you can't really just put them on that because now you're just really tossing the buckets of serotonin into their system and causing problems. So. Anyway, all right. So good luck to him with that. And there are things they can do. And the other thing I would say is ask the oncologist if they have a palliative medicine professional nearby that could make some of these referrals to an acupuncturist that's qualified to do it, not some jerk off that took a weekend course, but rather someone like Dr. Scott, who I have utmost respect for because he spent 4 years of his life learning how to do what he does, and he doesn't just do acupuncture. So, by the way, your partner did a really good job on one of my patients.
Oh, cool.
That's all I'm saying.
That's cool. Yeah.
So anyway, without giving out any information, but yeah, thank you very much. Anyway, so so see if they have palliative medicine. That's one of the things that they're there for. Palliative medicine is not hospice. Only 10% of what palliative medicine providers do is hospice. 90% of it is for people who are still pursuing active treatment, and some of them may even be, have curable disease. So, but they can help sort of manage the symptoms of cancer and cancer treatment when the oncologist they just want to, put needles in your arm and dump, toxins in your vein.
Yes,
right, Lydia?
That's my goal. Yes.
All right.
Good old Lydia.
She's again.
Hey, Dr. Steve.
Hey.
And crew.
Hello.
How are y'all doing?
Good, man. How are you?
Oh, that's good. Me too.
Good. Well,
hey, I got a question about studies on clinicaltrials.gov.
Okay.
Can you do a little segment and teach us how to read those damn things?
Nope.
Because
Remember the time that we tried to do that on the fly? I said, well, let's go to clinicaltrials.gov. And we found a trial that it said it was completed and it had the data there. And I wasted 5 minutes of this show that no one will ever get back trying to figure out what in the hell they were trying to tell us.
It was terrible.
It was terrible.
I don't know. How do you tell us if something?
I left it in for the same reason I left the Tacie DeLoach stuff in, because it's educational to people.
Something is good or not. I just see a bunch of medical jargon on there.
Yes, it's awful.
If you could
So clinicaltrials.gov is a great place to go if you have an illness or someone has an illness, or you're a provider and you want to find a clinical trial for one of your patients. You have to wait until the paper is published to get anything out of that reporting site, because they'll say, oh, yeah, it's completed, data is available, and you go there, and you can't make any sense out of any of it. So they don't want you to be able to figure it out because they want to get a publication out of it. So that's part of it.
So I go quite frequently when we get to later treatment lines in patients.
Yeah.
And so I could give just a couple of tips.
Yeah.
When you're looking at something. So, of course, there's first you can search on clinicaltrials.gov by your radius, right? So your disease state, then your country, and then the radius that you would be willing to travel. And then from there, there's a brief description of the study, which should...
That part's very understandable.
Yeah, very clear. So you would also look at the phase, right? So we have phase 1, 2, and 3 studies. Right. Phase 3 studies is going to be some type of intervention that has already shown efficacy. Right.
So they had to show some efficacy in the phase 2, and then phase 3 is looking for rarer adverse effects.
Exactly. So
because it's larger.
Yeah, if you can get yourself on a phase 3 trial, that would be preferred.
Yeah.
Right.
So that's not what he's asking, though. What he's asking is you go there and let's just say, okay, so you want to know, does ivermectin, now we're going to get banned because I mentioned the word. When I put it on Twitter, I spell it with exclamation points and stuff. But anyway, to defeat the algorithm, man. But so you want to know if ivermectin is effective in COVID-19 in the hospital. And they've got a trial, and they've already recruited, they've finished the trial, and they've outputted data. That's the part he's talking about.
I gotcha.
Because when you go there, you can't make heads or tails out of the data that they've put on that site, even though they're required by law, I guess, if they have an NIH grant, I guess they have to put the data there, but they put it in such an incomprehensible fashion that you can't really say, yeah, this worked, or no, it didn't. And they don't have to publish a conclusion or an abstract or anything. So you got to wait till the article is actually published.
Yeah, I go by the context clues of the phase, right? So
yes,
phase 2, we know, okay, so it was tolerable.
Right.
Perhaps there's some efficacy there. Phase 1, it might not be tolerable and it might not work.
Right.
But if it's
a pilot
phase 2, it's got
thing.
some efficacy.
Phase 1's just you do 40 people just to make sure you don't kill everybody off the bat, and that it gives you enough data to just say, hey, maybe this will, be worth going to phase 2. And then phase 2, you'll do about 300 people. Phase 3, about 30,000 sometimes. And then we're in phase 4 for molnupiravir right now, for example. Phase 4 is post-marketing. So that's when you really tease out the truly rare adverse effects, is when you start giving it to millions, and in the case of the vaccine, billions of people. And then you'll see 8 or 10 of this or that come out, and you try to tie it to the to whatever you gave them. So pretty interesting. Yep. Excellent. Thank you. So the answer is no. Let's see how much time we got. Oh, we got enough time. Here's a poop one.
Hey, Dr. Steve and Dr. Scott.
Hey.
How are you?
Hey, good. How are you?
Boy, that's great to hear. Hey, Dr. Steve, this is Alex from your Discord server.
Hey, Alex.
You were kind enough to respond to my question related to newborns and how they require their microbiomes from their mothers through either vaginal birth or post-C-section medical intervention. My follow-up question is this. Is my poop the same as my mom's poop and my grandma's poop and my great-grandma's poop, and so on and so forth, stretching back generations. Just curious. And
it's a delightful question.
I love
everybody should join the Discord server that the great Cardiff Electric set up for you.
That's our boss.
It's a lot of fun in there. We need more people, so maybe you could put up a link somewhere. Thanks a lot. Bye.
I do appreciate our network boss creating a Discord server for us, but we do have the Reddit, and we've got the website, and we've got this. It's too much. So I've gotten into the Discord, and it is fun to get in there, and you can do live chats and stuff. And but I'm too stupid. I'm just too much of a boomer to figure Discord out. Mm-hmm. So I'm going to work on that. But anyway, we do have a Discord server. It's just weird medicine. This is a really interesting question. So, and I've gotten conflicting answers. One answer in Sweden, they did a study in Sweden, and they sampled mothers' stool for E. coli strains, and then they sampled the kids' stool for E. coli strains. And what they found is we have such a clean environment now when we deliver babies that that the kids didn't colonize with E. coli for like 2 months. And so they were getting it from somewhere else. It's like, where the hell are they getting it from? They're not. We shouldn't be eating E. coli, but you get it on your hands, or it doesn't take very much, and then it works its way into the colon. It likes to live there, and so it proliferates. But now this one here is an article: mother-to-infant microbial transmission from different body sites shapes the developing infant gut microbiome, and we know that we can't separate mind from body, and we can't separate the gut from the mind. And these people said that they looked at 25 mother-infant pairs across multiple body sites from birth to up to 4 months postpartum, and they showed rapid influx of microbes at birth, followed by strong selection during the first few days of life. And the maternal skin and vaginal strains colonized only briefly. And the infant continues to acquire microbes from distinct maternal sources after birth. So these mothers are gross. They got E. coli, I guess, on their boobs or whatever if they're breastfeeding. I don't know. Maternal gut strains proved more persistent in the infant gut and ecologically better adapted than those acquired from other sources. So yes, that would support his hypothesis that the poop, the E. coli that his grandmother had is the same as his mother's. Now we do know that mitochondria are passed down from mothers to their children. Sure. So, but as far as their poop organisms, it's still up in the air because I've got two completely different studies saying two completely different things, and they're both pretty authoritative. So
cool.
Anyway. All right, so Dr. Scott, you got a question from the waiting room, as we like to call it here in the Weird Medicine Cardiff Electric Studios.
Actually, we have two now. We
do?
Actually have a second one.
Excellent.
Which is pretty good.
All right.
So let's start with Lady Trucker, if I can get back in front.
Okay, Lady Trucker. Hey, welcome back.
Welcome back.
Yeah.
We're glad she's back.
All right, what do you got?
The essence of the question is why is 39.5 BMI the magic number for elective surgeries?
Right. So why is 39.4 okay, but 39.6 isn't?
Right.
And I was thinking about this the other day. Go ahead, Tacie.
Well, didn't she lose weight? Didn't she say that's important to recognize?
Yeah, no, she's done great so far. She's already lost 45.
That's awesome.
Excellent.
Good for her. That's not easy.
No, hell no, it's not. Actually, I dropped under 200 for the first time since COVID.
Really?
Quit bragging.
It's good. It's good.
Yeah, I'm at the lowest. This morning, I'm at the lowest that I've been since. Yeah, for quite some time.
And I'm at my highest.
Yeah.
So, yeah.
Well, you're retired.
Okay, wrong card. No.
Muscles.
Yeah, it's all muscle.
Muscle weighs more.
Yeah.
That's right.
It's all that eating out on the road.
We're both going to fix that.
Yeah.
Because I have got a ways to go to get to my ideal body weight. And I used Noom, but Noom was a challenge for me during COVID, particularly during the worst times, because I wasn't able to concentrate on what I was eating. I just had to grab something. Mm-hmm. And a lot of times, I was fasting all day long, and then I'd get home and I'd be starving. And when you're, what I found, it's amazing. and people think this is bullshit, but breakfast really does matter because the days that I would even just eat an apple or I would do a protein shake or something in the morning, and then I wouldn't just be gorging at night, I would, or even if I did, I would still either gain less weight or I would lose more weight than if I fasted all day. You'd think, well, God, I didn't eat breakfast, I didn't eat lunch, I just ate, a somewhat sensible dinner. But your body goes into starvation mode when you start burning fat cells that rapidly. And it goes, oh my God, we're starving. We need to conserve every calorie that comes into us for the next couple of days till we get caught back up again. And it makes it a lot harder. And the days that I just eat a little something in the morning, I do much better when it comes to my weight loss.
Oh, yeah, shoot, yeah.
That was one of the first lessons of Noom.
Yeah, I know. You did Noom?
I did Noom.
Why?
Yeah.
You're
After postpartum.
Oh, really?
Yeah.
Yeah, I love Noom. You can still go to noom.drsteve.com and get 20% off or 2 weeks free. I just realized that the other day.
Cool.
So we haven't been pushing it, but yeah, I love Noom. It helped me in ways that weren't just weight related, and it made me understand that scale, the scale isn't the only thing. It's how you feel, and there's non-scale indicators that you're doing better, including getting your belt to tighten it a
That's an
lower notch and
NSV,
stuff.
a non-scale victory.
There you go. Thank you. There you go, Tacie.
Give yourself a bill.
Another one of those for Tacie.
She's on a roll, baby.
All right. So the reason is that there are studies that show increased post-procedure morbidity, in other words, complications, the higher your BMI is. So unless you're having weight loss surgery, they really won't. There's a lot of surgeries that they don't want to do. And, sometimes it's hard to close an abdomen that's got a foot of fat tissue between the skin and the guts.
Well, yeah, and the other thing is,
if it pops open, it's hard to get it to close. Go ahead.
And the other thing is spinal surgeries. A lot of times the instrumentations
they can't get to it.
Can't get in there deep enough, so it's just not long enough. So the thinner you are, the easier it is for the surgeons to get in there and do their procedures.
But I was thinking about this the other day. These sort of artificial boundaries that we set for ourselves. For example, is it okay for a kid who's 20? It's illegal for a kid who's 20 years old and 364 days to buy liquor, but the next day they can. Now, there's nothing magical.
Makes no sense.
Or that they can't vote, when they're 17 and 364, but the next day somehow they have the wisdom to make choices that are going to affect all of our lives.
Yeah, it's bizarre.
Or they can they can enlist in the military.
Yeah.
It's also, so and people say, well, you just have to set the line somewhere. So, and then when you get to voting, it becomes, it's a political issue. Because Robert Heinlein said, he was a science fiction writer, but he was a political thinker too. And he said that if you don't go into the military, you shouldn't have the right to vote. So he was one of those guys. So if you didn't serve your country for at least 2 years, then you shouldn't be allowed to vote. So, you can get into all kinds of stuff like that. There's other ways to do it other than an age cutoff, but age cutoff seems to be the most fair because it doesn't discriminate against something that you've done or who you are or where you live or any of that stuff. If you're 18, you can vote. If you're 39.4 BMI, you can have that surgery. Even if you're 39.6, you can't. I don't know. They just have to set the line somewhere.
All right, you ready for question number 2?
Yeah.
This is the winner.
Uh-oh.
I think this will be a good one to wrap it up on.
Okay. Oh, why? You want to get out of here?
Yes.
Oh, God. Okay.
Sorry.
All right. Sorry I kept you all here.
Actually, I've got to go pay a guy who put on my roof here in a bit. But anyway.
Okay.
Hey, so no, seriously, Larry has
Lawrence.
Yeah, Lawrence has the question of the day so far.
Okay.
Long story short, we have a shower head attachment to clean out the bunghole to prepare us for activities.
Yes.
Is this safe to use daily, or am I washing out too much stuff? That's an excellent question.
Oh, no. It's,
no, that's a great question.
So if you have a bidet, it is a great question.
Yeah, very good question.
If you have a bidet, and Tacie can attest to this.
You need one if you don't.
Yeah, you do.
You do. Yeah.
Especially, we bought our bidets when you couldn't buy toilet paper anywhere. I remember going to the store, and I was walking behind this lady, and they actually had toilet paper that day, and I went, oh, thank God. And she said, do you want to go in front of me? And I'm like, no. And then she turned around to me and went, then get back 6 feet. I'm like, okay, sorry, lady, Jesus. Anyway, I don't think I pose any danger to you, but it was in the early days of the pandemic, everybody was a little bit freaked out. But so we got our bidet then, thanks to Robert Kelly. And you can, I think we have one. We do on stuff.drsteve.com. You can scroll down and see it. $70 for the Tushy. It is plastic, but we've had it for almost 2 years now with no problems whatsoever. And if you want the highfalutin, cityfied one, it's like $10,000 for one of those Toto toilets.
The Toto ones are outrageous.
But they're awesome, though. Don't they heat the water and all this stuff?
Yeah, warm water. And
well, I'm going to my elbow to get to my knee to tell this story, but when you do that, you can divert the stream to actually give yourself a mini enema. And it's actually quite nice. You get less seepage later and all kinds of things.
Now, that's something I've not done.
Really?
Yeah, divert the stream.
You just do it sort of tangentially to the ring of death.
Yeah, Steve, I'm not. Yeah.
The ring of doom. Yeah, okay, but you can do it. You can situate yourself just right, and it's totally fine to do that. You're not washing out too much of anything because you can never wash out to everything in there. Matter of fact, the guy that called in earlier in the show, who is a grown man and an attorney, talking like a lunatic on the telephone, and I don't think he'd mind me telling this because you don't know who he is, but he had a prostate biopsy, and they went in, they cleaned out they gave him a bowel prep, cleaned out everything, put prep in there that kills all the bacteria, and they stuck a needle through his rectum into his prostate to get the prostate sample. He still got septic from that, so you can never clean it all out. You can clean it out enough that you can have some activities like they're talking about and enjoy consensual relations and ass play and stuff like that. But you're not, using a shower head, you're not doing anything.
No.
Now, if you were doing high colonics every day, I would say that might be an issue.
But no, not this.
And even then, I don't have a whole lot of data that says it's an issue, but just shoving something up your ass and then just filling it up day in and day out is probably not
for complications.
Yeah, that's what I'm thinking too. So, if you have a procedure, if I give you a procedure, PA Lydia, to do, and 1 in 100 people are harmed by it, and I give you another procedure where 1 in 1,000 people are harmed by it, you're going to be hard pressed to tell which one is which until you've done maybe 10,000 procedures. That would be the only way. So when you're doing something like that, if there is even a minuscule risk of complications, you do it every day, something bad's going to happen. So, but yeah, what you all are doing doesn't sound like you're doing anything that would be a problem. Okay.
All right, guys.
All right, we ready to get out of here?
Do it.
Yeah.
All right. Okay. All right, Tacie.
I mean, I don't mean it that way. I'm just not. I'm so busy. I just need to not sit down for us all.
Okay. I'm glad that you found things to occupy your time. Thanks always go to Dr. Scott. And we can't forget PA Lydia and Tacie. Thank you for being here. Both of you are awesome. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, that Gould girl, Lewis Johnson, Paul Ovcharsky, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, Roland Campos, sister of Chris, Sam Roberts, she who owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double, Steve Tucci, who we'll be seeing in 6 weeks, right? Tace?
Yes.
Okay, yes. Great.
Sorry.
The great Rob Bartlett, Vic's Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, the inimitable Vincent Paulino, everybody, Eric Zane, Bernie and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, Fez Watley and GVAC, who supported the show. never went unappreciated. Thanks to our SiriusXM show. Thanks to our SiriusXM show, we have a podcast. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners, whose voicemail and topic ideas make this job very easy. And go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. All right, very good.
Goodbye, everybody.
Goodbye.
Bye.
Goodbye.
Goodbye.